And you know that these MP aspirants or even the incumbent are doing this within the period of coronavirus, so social distancing will be observed when the election is convened as the primaries by the MPP. We'll bring that all live to you, but talking about coronavirus is still on, and you would know that on Wednesday we had the Director for Health in the Ashanti region convening a press conference and then informing the general public that treatment facilities for COVID-19 are now full, and not only in Kumasi but other peripheral facilities as well. So we're having a tour of the treatment facility ongoing currently at the Kumasi South Hospital because we need more beds, so to speak. Ohimi Interior is the man always on the beat from the Ashanti regional capital. And Ohimi, so far, what can you tell us?
Good morning, Roland. Yes, we are reaching our viewers live from the Kumasi South Hospital, one of the treatment centers for COVID-19 in the Ashanti region. As you have already known, the Ashanti region has two treatment centers, one at the Konfanochi Teaching Hospital, an 18-bed facility. We are told that one is meant for critically ill COVID-19 patients. And then Kumasi South Hospital, coincidentally, the regional hospital for Ashanti region, is the biggest treatment center with 22 beds here in Kumasi. This is also meant to treat moderately ill patients of COVID-19. Just yesterday, the Regional Director of Health, Dr. Emmanuel Tinkran, announced that treatment centers in the region are full, except that with the isolation centers, that is 207-bed capacity isolation center, it already has 156 patients on admission. So this morning, we took it upon ourselves to visit the Kumasi South Hospital to see how expansion work that the regional director announced is going. He said with the completion of expansion works, they expected that at least 100 beds will be added to the already 38-bed treatment centers in the region. So here at the Kumasi South Hospital, additional 20-bed capacity treatment center space is being created for the treatment of COVID-19 patients here in Kumasi. So behind me is a treatment center, and just here I've seen a couple of workers who are busily working on site, and this is already built a facility that needs a small, what I would say from my own layman's point of view, it doesn't require so much of work to put it in shape. But we'll be speaking to the medical superintendent for Kumasi South Hospital, Dr. Ofori Buadu, for more details on how work has been ongoing. So it's interesting to see that you are doing this to support the COVID-19 treatment in the Ashanti region. Let me find out from you, already before COVID-19 came into existence, there were discussions that Kumasi South Hospital is already overstretched and now you have additional responsibility. How is your facility coping with this new trend?
COVID has become the center stage of treatment, the past 3-4 months. And so we had no option than to support the effort of government, to see our brothers, to see our sisters. So yes, we are overstretched. The bosses, the Director General, the Regional Director himself are very much involved in their management. I must say that last Friday, the DG himself was here. Dr. Kumasi was here to assess the situation. And then together with the Regional Director of Health, we have been directed to do some expansion works so that we can accommodate a few more of the COVID-confirmed moderately ill cases. So that's how come we are expanding, we are doing this.
Now you have two more, or let me say more facilities to be used as treatment centers for COVID-19.
Yes, it's not magic, it's just management. What we had to do, like we said earlier, we have suspended some services. And then we had this what we call the antenatal ward. So what we did, was to reassign the nurses and then the cases here to another site of the hospital, to the VIP ward, and then that's where those cases are being managed. And then we have, like you can see, converted the entire block to COVID management.
All right, so Dr. Body, can we go inside and see how work is ongoing?
Sure. So the whole area here are going to be, they're going to level the place, put some, so that access to the place becomes easy. You know, we have a protocol for our treatment centers: the green area, the red area, the entry for staff, entry for patients, exit for staff, you know, and so all these have been considered. So here you are with, we have 1, 2, 3, 4,
Hello,
5, 6.
They're touring the treatment facility at the Kumasi South Hospital, and we're going to bring you more of this news at 10. He'll be there, and then we'll go live to him once again. But you can see the pictures are live, definitely. But, well, that's it, right?
So this will have a 100-bed exactly. Yeah. Well, we want to say happy birthday to Joseph Joe Jetwa from your brother Nanayao. God bless you with more ages. It's your birthday today. Enjoy your birthday, Joseph Joe Jetwa. And Roland has some shouts before we wrap.
Yes, the very Reverend Father Minta of the St. Patrick Atomic Church is also wishing a number of or giving a number of wishes to Father Hilary Agbonosi of the Saint Belikita Church at the Community
Bakita.
20 area. Okay.
Yeah.
And then Father Amos Abinyi of Cape Coast Diocese as well.
All right, so the tour of that facility will be on News Desk in the next hour. Thank you for watching the AM Show. We'll see you tomorrow, God willing.